So let's get started. So welcome, Jason. Thank you so much for joining us today. We're going to chat today about medication review. So let's start off with the big question. What is it?
So basically, a medication review is when you sit down with a healthcare professional, be it your physician, pharmacist, nurse practitioner, and kind of review your medications and what the goals are of each medication, and kind of looking at some way to improve how maybe you're taking the medications, or maybe we try to get rid of medications. Just look at everything comprehensively and see if we can make some tweaks and changes that make sense and would improve your health journey.
Excellent. Let's move forward maybe into what is the function of the medication review? Why is it important?
The function of the medication review is important to really kind of hone in on things that might be problematic in sort of the medications you're taking and the conditions you're taking them for. So to sit down and make sure that everybody is on the same page and that you understand why you're taking the medications, what they do, what the possible risks are, and then also looking at ways we can kind of change things so that maybe we're looking at drug interactions specifically. We can kind of do a targeted one where we're looking at one condition. So say you have arthritis and we're trying to look at the progression of the medications and to see if they're actually working. We can track the changes, discuss with you and say, okay, maybe you're not taking enough Tylenol or you're taking too much Advil. So very targeted. We can do a comprehensive one, which is kind of all encompassing. And we're kind of looking at all conditions that someone might have and all the medications they take and all their health goals. We can also look at more specific ones like say someone's doing polypharmacy, which means you're going to multiple pharmacies and multiple doctors and getting multiple prescriptions, but maybe those aren't all in one space so that you can kind of see that someone can look and look for drug interactions between them. And so sometimes trying to get things all from the same healthcare professional group would be advantageous. And we can kind of look at that and say, hey, you're actually taking two of the same drugs. You might not know it because you're talking to different people, and we see that, for example, a lot when someone goes to a specialist. So they see their regular family doctor and they're on certain medications. They go to a specialist and they tweak something, but then perhaps the patient's not told that, okay, we're going to put this on, but that's going to replace this other one. So there's not that communication between the specialist and the family doctor or the pharmacy. So you end up taking redundant medications. And so looking like, why are you taking two acid blockers? It just doesn't make sense.
Mhm. If somebody's going to the same pharmacy and they get a new prescription, um, do you notice? Like, is it common that you notice if you're like, do you review all the medications that somebody's been doing previously, or is it here's the new prescription? Um, whether it's yourself or anybody in any pharmacy filling it, like, do you review the stuff that they're already taking, or is that something there's a big reason that you need to sit down and look at everything?
So when someone brings in a prescription, you do look at sort of the comprehensive, you sort of record that they have, and either on your local system, or we can also look on Netcare, which has kind of everything. So if it's not necessarily your pharmacy, you can find out what's at other pharmacies,
Okay.
and a review can take on many forms. It can be as simple as you just looking by yourself, just looking at and saying, okay, this is redundant. It doesn't
Mhm.
necessarily have to be a conversation with the patient. You're just looking at the whole picture on your own time, or so it doesn't have to be a sit down meeting.
Mhm.
To do a more comprehensive one and to fully understand what's going on with someone's health journey, it probably is better to sit down and actually talk to somebody. But it can be from as simple as me looking like, okay, your blood pressure is this, you're taking two blood pressure medications. Maybe I'll quickly look and say, okay, you should be taking those at different times. So I can just tell you that specific to your blood pressure, and we
Mhm.
can deal with that. And then maybe the next time you come in and we look at your cholesterol medications, we talk about something like that. So it can be like a mini review almost each time you come in.
Mhm.
So it takes on different forms. And the goal is to kind of look at sort of the whole picture at what they're taking with you and with other pharmacies and they're getting from other locations.
Yeah, and it shouldn't be expected though, because you guys get excessively busy. I know, especially during cold and flu season, and you've got your immunization season. It shouldn't be expected that whoever's filling your prescription is has the time to look at all of that when you have a new prescription. So it is really important to sit down and review things,
Mhm.
correct?
Yeah, it is. It's good to sit down and look at things and kind of at a time that works for both of us, because like you said, we do get busy in the pharmacy, and there is time constraints at certain times, but then there's, if, as long as we both set aside the time, we can figure that out. Um, and sometimes it's just a review on the fly. Like sometimes it's just, hey, I have a bit of time. Do you have a bit of time now? Let's kind of sit down and chat. And it doesn't have to be a big, huge process, a big organized, structured event or anything like that. It can just be something as simple as let's go through your drugs. And if you have 3, 4 medications, it probably only takes 5 minutes to kind of go through them quickly, find out why you're taking them, why, what you think they do. And if I see any kind of concerns with duplications or interactions or something that might be of risk, then we can discuss that. And that should just take a couple minutes. It doesn't have to be a big process.
Okay. And then who can you do a medication review with, and who's a better person to do a medication review with?
Anybody potentially could be due for a drug review. Could be something that maybe you're taking stuff at home, like maybe you're taking over the counter stuff and you have concerns about it, like duplication, like, hey, I take Advil for my knees and then I take a leave for my elbow. And it's redundant. You're taking two anti-inflammatories. So just because you're not taking medications that are on my system that show up at the pharmacy doesn't mean you couldn't get something. Or another classic example is someone comes in and they're taking Tylenol for arthritis, and they're kind of taking the maximum dosage, which is around 3,900 milligrams if you're taking the Tylenol arthritis. And then now you have a cold. So now you're going to add on some cough cold medication, which also contains sometimes high doses of Tylenol. So a quick review, like it's nothing to do with my pharmacy systems, but it is still a review. You're asking me some questions. I'm just clarifying and making sure that everybody's on the same page and doing things safely. So anybody could be, potential for a review.
So what other kind of things outside of prescription drugs? Because it's a really good point. You're taking Tylenol or with drug interactions, like should you list all of your vitamins that you're taking? Is it a topical cream that you're taking, like A535? Like, are those important to,
Yeah,
to talk about too?
they are. So what I would ask people to do is to kind of take a list, or even if they want to bring it in, of all their medications and over the counter, anything, basically anything that they take that would be related to health. Um, and a lot of times there might be interactions with some weird vitamins. Or another example that I always look at is if you're on acid blocking medications like Prevacid or Pantoloc or Tecta, these kind of medications that block acid production, they do change the type of calcium that you can take, because certain calciums don't absorb as well without that pH of the stomach, without the acid.
Okay.
And so if you bring your medications and I see you're on one of these acid blocker drugs and you're taking a calcium carbonate, you're not maximizing the absorption of that calcium. So then I'd suggest, hey, I see you're taking this over the counter. Wouldn't normally something you would think to talk to me about, but I see an issue there. And then
Okay.
also looking, okay, these drugs also block the absorption of vitamin B12. So you may not be taking this already, but let's look at supplementing with a vitamin B12 to make sure you're not going to be deficient in B12, which quite a few people are, especially seniors and that, depending on your diet. So it's not just your classic medications that I see on my computer system. It's kind of good to kind of go over everything and kind of take a comprehensive picture. The other thing is calcium with interactions with medications in terms of absorption. So someone on a medication for their thyroid, calcium or magnesium, aluminum, any of these types of mineral things can reduce the absorption.
Mhm.
So just finding out when you take it and kind of coming up with a chart. And another thing I like to do when someone comes in, I like you to bring your medications so we can shore them all up. So, a lot of times people feel they have to go to the pharmacy every 15 days because they're out of this one. So they go for that one medication, and 15 days or 20 days later, they're out of this. So I'll look at all your stuff and say, okay, we have 20 days of this medication. We have 60 of this. We have 49 of this. Why don't I give you 80 of these to make you up to 100? I'll give you 51 of these to make you up to 100. So we get you, when you walk out, you've got 100 days or whatever you want of medications all at once. So in 100 days, they all come due again.
So what you're saying is you're going to save the money and time.
Yeah, exactly. Yeah. And it's more convenient for us too, because then it's less, you come in one time and we can get everything done at that one time. Obviously there's going to be things that are started at different times, and you're 50 days through this medication now that we've done, and now you start a new medication. So sometimes we have to kind of revisit that in, period of time and kind of do that again. But at least for the bulk of it, you're only coming in once. So especially when it's like minus 30 in the wintertime, coming in once versus having to come in multiple times. I mean, by all
Mhm.
means, you can come to the pharmacy multiple times if you want. Doesn't mean you can't, but just making it easier for everybody to have that one visit, that one fill.
Especially when it gets snowy and
Totally.
yeah.
Yeah. Yeah.
All right. Um, so what happens at a medication review? What's the process?
So we would, depending on kind of the level of a review we're going to do, but basically we would sit down and look at all your medications, kind of come up with what you're taking, when you take them, and why you think you take them to make sure that you're on the same page as what we're on. And sometimes medications are taken off label. So that's why we always ask, why are you taking them? It's not that I don't know what Pantaloc does, one of the medications. I know what it does, but why you're taking it might be very different. So you might be taking it not because you have heartburn, but because you're on low dose aspirin and they're worried about the development of an ulcer. So the why you're taking it is different. So if I just assume you have heartburn because you're on Pantaloc, then it changes my recommendations potentially of what's going on. So the why you're taking them may seem kind of like duh, like you should know that you're a pharmacist, but it's not always just that simple.
Yeah.
So kind of gather all that information and then make recommendations based on that. So if you're taking, for example, two blood pressure medications and you just take a whole handful of stuff in the morning, looking at that and saying, okay, we're taking two blood pressure medications that are going to kind of sort of peak at the same time. And when the effectiveness of that medication peaks, it's going to lower your blood pressure more because they're both acting at the same time. So let's maybe look at one that might make more sense to take in the morning, like a diuretic, and then something you can maybe take at bedtime. So you kind of got different peaks and protecting that blood pressure overnight. And part of my reasoning behind that, which, I don't always necessarily have to go through all the reasoning because it might be a bit too much, but people tend to have a spike in blood pressure first thing in the morning when they wake up because your body releases a surge of hormones to kind of wake you up. And heart attacks, for example, you're more likely to have it early morning hours than you are later in
Okay.
the day because of that, all the epinephrine that your body releases. So let's take a medication at bedtime for
Mm.
blood pressure that'll be working and peaking in the morning when you're waking up and going to blunt that increase in blood pressure. So just looking at all that, it might not just be as simple as it seems. Like there's a lot of stuff that goes on in the background that you're thinking, okay, let's just and I may take the time to explain it. It depends on the person and how much time you have. But sometimes I
Mhm.
just say, let's take this one at bedtime and you know, just you're kind of looking at it and it is kind of you kind of do want to explain stuff so people understand the why,
Mhm.
but sometimes it might just be let's do this.
So when people come in for review, you already mentioned, bring in all your medications. I guess create a list of all of the naturopathic stuff or the vitamins or the over the counter things. With those kind of lists, is there is that something that people should keep up to date and handy for other emergency situations? Like it's don't just do it just before you go. Is it important to have those lists and with the details?
Yeah, and we can print off something like that, or we can like if you
Oh,
want to
okay.
handwrite it, if you want to put it in your phone, if you like people have different ways of doing it, and I've seen some interesting things, but a lot of people keep, a little record on their computer and they'll just kind of update it as they go along. Sometimes they'll print it off and then, they cross off once a day and now it's twice a day, so they write twice a day in there and maybe don't update their computer. That's why it's kind of nice. What I'll sometimes do for people is almost create like a blister template. So say you're a blister pack patient, there's a
Mhm.
list of your medications and the time slots you would take it and that create something like that for them so that it stays on my computer, even though I'm not going to blister pack for you necessarily, which we could, but even if we're not, I can update that as time goes on so that I can present you a new list of medications each time you come in so we can be up to date on both of that. So
Okay.
whether you do it or I do it, it's good to keep those. Sometimes those don't always show up with the over the counter things you're taking at home. But when I print that list off, there's always extra spots at the bottom that you can write in your own medications because sometimes it's kind of onerous to put all those medications into my system. But I mean, we could if we wanted to, but you can just handwrite those in.
Okay. And for those people who don't know what a blister pack is,
Yeah, you don't have to blister pack necessarily, but a blister pack is kind of our way of doing what we talked about, but me ensuring that it's being followed by you. So
so it is an actual like how do you make those blister packs for people? What is a blister pack?
yeah, so
Or
most of them are laid out. So it's 7 days of medications in one card. and there's 4 time slots on that card, and then the 7 days. So you got Monday, you got a morning, noon, dinner, and bedtime. So there's the 4 slots, and we fit all your medications and kind of time it out so that some people want to just take 2 times a day. So they just want to do a morning and a bedtime. They don't want to be taking stuff through the day. They go to work or they're doing programs through the day. They don't have to be carrying this around.
Yeah.
Whereas other people, they're at home most of the day and they can do something 4 times a day. So it's basically just laying it out for you. And generally, we do 4 weeks worth of medications at a time. And we do that because if there's a change in your medication, I always think if someone's on a blister pack, they're probably on multiple medications and they're or maybe multiple conditions, and there might be some changes. So you go to the doctor and now they stop one of your medications. So we have to then get all the blister packs back and take that medication out and maybe put the new one in. And if you got like 3 months worth of medications, that's 12 packs. That's a big bunch of packs that we
Yeah.
have to redo. So it just makes sense to do 4 weeks. It does cost a bit more, but for the service and for the benefit of it, I think
Yeah.
it might be worth that few extra bucks, and not dramatically more, but there's a bit of a cost to it, but
Yeah. Okay. Ease of use.
definitely.
Yeah. So what are some of the challenges around doing a review?
Challenges, I think, in a pharmacy are mostly time constraints, and it does get busy. People are busy. Sometimes, even though the best intention, so you say, okay, well, why don't you come in Tuesday at 2? And then suddenly Tuesday at 2, you're slammed with 100 prescriptions sitting there waiting to be checked. And it's like, just not a good time, right? Like, sorry, I meant to call you, but it's just been really busy. So, and vice versa. Some people forget to show up for things too, right? You book something and then you book it a couple months in advance, and then you
Totally
just
forget it.
forget,
Yeah.
and no one calls to remind you. And like,
We've all done that.
but yeah, but yeah. So sometimes there's time constraints on both sides, right?
Yeah.
And
Okay. Um, difficulties, and in the description, we called it a bonus question.
okay,
Um, difficulties around dealing with different medical professionals. Um, I've heard some stories where you get a couple of specialists in your family doctor, and then another doctor's involved, and they all have their own opinions on what you should or should not be taking. And they put you on different things. How do you navigate dealing with all of the different professionals and organizations that are prescribing and providing healthcare,
yeah.
especially as a pharmacist, and then as a patient? How do you work through those?
So a lot of times, I mean, someone's sent to a specialist for a reason because they are a specialist in that area. And so generally, kind of just probably a general consensus is that would be the medication or the plan that should be kind of followed. Why send them to a specialist if you're not going to really look at the recommendations? And sort of the issue is then when they come back, then was there communication between the different prescribers to say, okay, we've been started on this medication, we're redundant with things, we forgot to take this one off, right? So, and the specialist may, that's kind of the specialist would be looking at that too in an ideal world. But I mean, things happen and they're kind of looking at a very targeted. So, say you're going to an endocrinologist, they're kind of looking at your diabetes. They're not so concerned with your heartburn, or they're not so concerned, not that they aren't, but it's just they're a specialist. They're looking at one kind of area.
Hmm.
And so, when you come back with that new prescription to the pharmacy or you talk to your family doctor, the group should be looking at this as a whole. It's not just one person's job. It's just not just your family doctor's job to say, okay, we need to take this off. It's kind of looking out for each other and kind of working together and respecting that, hey, someone might have a different opinion, but what is the best interest of the patient, right?
Hmm.
And what's working for the patient. So it's not just one person's job to be responsible for this. It's kind of a group thing. And I think the interesting thing in the pharmacy is that it all kind of comes to the pharmacy, and most people will tend to go to one pharmacy overall, but they
Hmm.
might have different specialists. So a lot of that comes to me. And so then my job would be to look at this and say, okay, let's communicate to your family doctor and say, hey, this is what happened at the specialist. Generally, the specialist would have communicated already to the family doctor what's going on, but there might be a bit of a delay there between when the family doctor can review that letter from the specialist and
Hmm.
kind of make changes. So if they're coming to me, I need to be able the one to make the first step and be like, hey, so-and-so is on these two drugs, like they're either one cancels the other out or they're redundant or there's some kind of drug interaction. And like, this is what the specialist recommended. Can we just go to this? And, or sometimes you see something that somebody's not taking as well. And so I do that quite often. I see someone who's a diabetic and their numbers are creeping up. And, we can look at people's lab values. And, when you look at a review, you're not just looking at medications, you're looking at their lab values and you see their A1C, which is a measure of the last 3 months of their sugar results. And you look at that and say, okay, you're kind of trending up. And I would fax the doctor, and I do this quite often and say, hey, would you consider? So I think it's
Mhm.
just how you word things. Um, and when you say, would you consider, you're asking, it's now a collaboration. You're not saying they should be on this medication. That is
Mhm.
confrontational on that. It's kind of like, do you think this would be a good idea to put them on Jardiance, a different blood pressure diabetes medication?
Mhm.
And then they can look at it themselves and review and say, hey, that's a good idea, or no, I don't want to put them on this because of this. And now it's a friendly communication, right? It's not
Mhm.
one-sided. It's not accusing the other of, like, you missed this, they should have been on this. It's a group effort.
Now you're talking about the different tools and resources that you have, and I know it's different between provinces. Um, Alberta, as far as I understand, everybody has access to one system so they can look things up or add to the patient file,
Yeah.
correct?
Yeah.
Is that's not true across the other provinces?
Don't know, actually. I would
Okay.
assume most provinces would have something in place. I just don't know how much access some pharmacists might have to it, or some other prescribers as well, like a nurse practitioner, those kind of things. I just don't know. But I know in Alberta, it definitely is great in that they're making this repository of all your data,
Hmm.
and they're tweaking it. So, for example, vaccines. So when you came to the pharmacy and got your shingles vaccination, prior to 2021, it wasn't required to be put on your records. You'd come there and it's now standalone. My pharmacy knows you have it, but
Hmm.
no one else would have it because it's not in that database. But coming forward from 2021, it now has to be entered in the system so that everybody's on the same page. And that's another thing we'll look at a review is look at things like your vaccination status. So I'll quickly peek at that and say, hey, I noticed you haven't got a tetanus shot. It's been like since 2001,
Hmm.
kind of 23 years past, and those should be every 10 years. So we'll look at that and say, let's get you up to date on that. Or I noticed you didn't get a shingle shot. And that's where kind of you having records as well is as important as me being able to look, because just because I don't see it on there doesn't
Hmm.
mean it didn't happen. It just wasn't entered because it was prior to 2021. So you need to say, okay, I had my shingle shot. I can find that in another part of Netcare, but it's not as readily available as looking just at the immunizations tab that we can view and look at everything. So
Hmm.
then I'll have to look at the medications tab and look at historical medications that have been prescribed from any pharmacy or given out by any pharmacy and find it in there. So I can find it. It's just so much easier when it's all in one spot.
Hmm.
And moving forward, it will be in that one spot.
Okay. Um, and I'm not too sure if changes have been made with the Alberta government kind of moving and things aren't being as connected. Like they wanted to specialize or break things apart a little bit with regards, I think, to like the hospitals and the doctors and they're a new system, I guess. Um, does that affect the net care, or is everybody still going to be putting all of that information into the same space? So you still have access to all of that.
Yeah, I don't know. I know there's some new systems that they're planning. I don't think the goal would be to take away from Netcare and reduce the visibility. And I can't speak to that. I'm not sure exactly what all that looks like. I'm It's
Okay.
really kind of my realm
Yep.
necessarily, but it would be nice. And this is just something that I notice is that sometimes on Netcare we see what other pharmacies give, and then we see like but we don't see if they come out of hospital what they were given in the hospital because that is
Ah,
it's not visible by me.
okay.
And so then you're kind of making, assumptions that, the prescription they've been given, they were either given those in the hospital already or, so there's just not as much visibility. So I don't know 100%, like I'm not sure at all, but
So
if
that's a
they're
good
adding
point
that
then.
on.
for keeping your own records, if you're given something in the hospital, by the hospital, you don't have access to that. So people really should be writing those down and letting you know.
Potentially, but a lot of times when you're in the hospital, that's kind of the last thing in your mind is worrying what IV you got. And sometimes when you're out of the hospital, that IV is not you're not on that because you're not going
Mhm.
home with an IV necessarily, right? So those are kind of a done issue for the most
So
part.
if they've given you any prescriptions or they've given you pills for whatever reason, those should show up probably because they came from a hospital pharmacy.
No, they wouldn't. And so that's the thing. So when people come in, so say you get discharged after, say, a heart attack or something like that,
Hmm.
you're given quite a list of medications that now maybe prior to that you were on one or two, and now there's like five they add on kind of. And so you would ask you would have to ask the patient, like, were you on these in the hospital already?
Hmm.
And if not, then like I can go through the whole list of them. But if you've been taking them and we know you're not reacting to them, you're not having side effects or anything like that, then it makes it, I don't have to be as wordy with going through everything. It can save you and me some time.
Hmm.
I mean, still we can look at them and make sure that when you're going home, you're not taking grapefruit juice with your Lipitor or that kind of thing, with your cholesterol medications, going through that. But the hospital also does a really good job of having their pharmacists and that go and talk to these people before they're discharged. So it's just kind of,
Okay.
if they've already got this information,
Yeah.
and you just had a heart attack, you don't want to stand there for another 15 minutes and have me go through the whole thing again at the counter when you already got that information. So it would be nice if I knew that they started that, say they started these medications 6 days ago in the hospital.
Hmm.
Well, you can't assume, but I would hope that someone went through the list of medications and told them certain things about it.
Hmm.
But I don't have access to see that at this point. So
Okay.
yeah,
Uh,
hopefully, I don't know the answer to your previous question, but hopefully that is coming. That will show up there as well. But I don't know.
okay.
I would like
Excellent.
it.
So I think we covered this one. So just any specific things that patients can do to help in the process of, doing the medication review. We talked about having the lists, bringing in the medications. Is there anything else that makes things just a little bit easier so that having that conversation is more streamlined?
Yeah, I think if people kind of had prior to a list of when they take stuff, so I can quickly review that instead of having to write it all down. Like maybe you have your own little chart and I take this in the morning and that,
Mhm.
then I can quickly look at that and tweak it versus reinventing it and having to go through each medication individually. I mean,
Okay.
by all means, we can do either way, but that kind of saves a little bit of time. And
Okay.
then if you might already have your vaccination status of everything you've had, and you already know you had the shingles, you had the Prevnar, you had these different vaccines. That would kind of save my time for having to look that up to say, oh,
Hmm.
okay, maybe we need your Prevnar. Oh, I already had it. Okay, so you could have told me that at the beginning, kind of
Yeah.
thing,
Yeah.
right? Yeah. So if you kind of have sort of an idea of your overall what you've already taken, what you've stopped, kind of gather that information for me ahead of time, and be prepared to discuss that. Or if I don't ask you the questions, then come up with a list of questions that you have about your medication. So maybe there's something that I didn't think about that
Hmm.
you never thought about. Like for example, with Synthroid. So some people, I might say, okay, now you need to take that on an empty stomach half hour before breakfast for your thyroid medication,
Hmm.
but you've always taken it with breakfast. Then I would tell you, okay, don't change what you're doing because now if you take it on an empty stomach, now it might affect the absorption. So you might actually be getting more of the medication than what you have been,
Right.
but your dose has been adjusted based on what you've been doing. So as opposed to me saying, oh, Synthroid has to be taken on an empty stomach, I'd say keep what you're doing,
Hmm.
don't change it, be consistent. And otherwise, we have to kind of do more blood work to determine if now you're getting too much medication because now you're taking it on an empty stomach. In an ideal world, that would have been discussed when you first started taking the medication
Hmm.
and had you be consistent with taking it before breakfast. But any changes like that, if we're going to change a whole bunch of stuff, we got to understand the consequences of doing that and what that would look like with your health.
Hmm.
So, yeah, so just giving me that kind of data information that I just take a whole handful of all my stuff in the morning works as well. Then I know when you're taking everything.
Yeah. Um, let's see. We covered that one. So moving into the future, I mean, we touched on it a little bit. There's a lot of changes coming. AI is coming. There's different, programs that we use to track everything. W- What do you see happening or things changing in the future um, for providing service or medication, are there any big changes coming?
I think part of it that is kind of making it a bit easier maybe to schedule that is doing virtual type calls. So then you can kind of set a time aside and it's not a big production. You don't have to come into the pharmacy. It's not, it's so kind of opening up those channels of communication. It can be something as simple even as a phone call. It doesn't have to be a big sit down thing. I mean,
Okay.
we do like to see people and kind of go through it face to face. We can, double check that they understand, but if it has to be over the phone and that's the way it works for you and me, then we'll figure it out and make it work, right?
Okay.
It's just nice to kind of be sitting down together and going through that list even on a Zoom call or something like that is kind of harder because you can't see what's on the table
Hmm.
necessarily. So it is kind of nice to sit down and go through things. And so even if we did that, say once a year, sat down and then kind of tweaked it throughout the year, if there's little changes here and there, we don't necessarily need to see the whole list. We've already produced a list at that one sit down visit. And
Hmm.
then maybe once a year, we just revisit that.
Okay. Um, Side question about all of the ads that you see on TV for new medications for different things. Is that better to talk to your doctor or is that better to talk to your pharmacist?
Talk to your healthcare professional. I think you can talk to either. I mean, pharmacists are kind of the most accessible healthcare professional there is. You don't generally need an appointment to go in to see the pharmacy. You can just drop in and ask a quick question, right? It doesn't
Hmm.
have to be a big production. You don't have to book an appointment. And just to see an ad on TV and it's like Ozempic, ask your doctor. Why would you book an appointment to ask your doctor, what's this Ozempic? I mean, nowadays people would search it up and see
They
what it's
Google
for.
it.
And
Yeah.
exactly. So now I think that to me nowadays, that's kind of not so much an issue with asking your healthcare professional. I think before the internet, that might have been a thing, an ad saying, ask your doctor, like, how would you look that up? It's probably not going to be in the encyclopedia
Hmm.
before the internet, right? But I think it just prompts people to look at it and then probably to come to us and say, hey, do you think, looked at this drug, I saw Rybelsus at one of the hockey games. I saw it come up on a big sign. What is that? I know it's a diabetes medication, but would that be something I could use for my diabetes? And
Hmm.
I think that opens up a great communication and to look at the different things that they're already on and where that might fit in and if it might fit in or if it's
Hmm.
dangerous. So I think those kind of things, because direct to consumer advertising in Canada is very limited. They can't say what the drugs are for. So if you watch American TV, they can say all this stuff about the drug. They can say what it's for and everything. Whereas in Canada, we can allude to the fact of what the drug
Uh,
is for, but we can't say directly this is for diabetes. And so it's just adding that extra layer on.
so it's not just a marketing ploy to make you go look it up.
Well, it for sure it is. It's a marketing play to go look it up, but you have to look it up because they can't advertise what it's for. So they can't say,
Okay.
ask your doctor about Ozempic for diabetes. They can just say, ask your
Right.
doctor about Ozempic or your
Yeah.
pharmacist or whatever, right? So it's got to be sort of like vague in some
Mm,
ways.
gotcha.
Yeah, because otherwise, because there's a bunch of off-label use and that kind of thing, and there's a bunch of nuances probably why, but just in Canada, we can't do that direct to consumer advertising. So, for
Hmm.
example, I know the Viagra commercials of years ago just said Viagra, and it showed a guy skipping because he's had an amazing night and he's all happy in the morning. And you got to make the assumptions, you got to draw those conclusions yourself. And like, why
Yeah.
is this guy happy? Well, he had Viagra the night before. So yeah,
Okay.
sometimes they're kind of cheeky ads,
Yeah.
but it gets you thinking.
Yeah. Okay. Um, so let's kind of wrap this all up together. So what are the big points of, you know, booking the review, um, bringing things in, having the conversations? What are the big takeaways you want people to really remember from this?
So with reviews, it's in the pharmacy, ideally I would be the one to suggest, hey, let's sit down and have a review, but it doesn't mean you can't come to me and say, hey, can you review my medication? So I think the bigger picture is it doesn't matter who suggests it or how it gets recommended or the fact that it gets done is a good idea. So,
Mhm.
if your pharmacist hasn't asked you specifically, hey, do you want to sit down and look at your medications? You can be proactive in your own health and ask, hey, I want to make sure I'm taking all this stuff at the right time. Can we find a time and look at this? And again, it can be a quick 5-minute consultation. Doesn't have to be a big process. Maybe you're only on 3 medications, but you just want to make sure that everything's working right. Um, and then with that, though, be prepared to have the full comprehensive information of your health and your medications. So, why you're taking certain things, what you take over the counter, um, what your concerns are with it. Um, Even, for example, bringing information about your sugar levels. So a lot of people now are wearing, sort of the buttons that they put on, and you can bring your phone with you and show, I can look at your graphs and say, hey, you are doing amazing,
Mhm.
or we need to tweak these. So it doesn't have to be just your drugs. It can be the effects of the drugs on your system. And if you got targeted specific information about your sugar levels, that is awesome. That is great information. So just bring anything you can think of that would be of benefit, or that you have questions about, or that you're unsure what these mean, and bring those lists of questions and the data, and we will look through it as best we can. And if we need more information, then we can follow up with a quick phone call and say, hey, you mentioned that you have this data on your computer or something,
Mhm.
or you're not sure what you forgot to bring, what type of calcium you're taking. Go home and take a look, give me a call back. And so we can do these follow-ups and kind of tweak things, not necessarily in a sit down, but we can kind of continue things. And so that's why there can be a mini review, there can be a comprehensive, there can be a targeted. There's a bunch of different ways we can do that. But I think the overall arching thing is to make sure that at least once a year we're kind of sitting down and looking at these things.
Okay. So you'd say once a year is probably
Yeah, I would say so.
a
Yeah.
good schedule.
Yeah, and especially if there's changes too, or like a major health, it could be more than that. If there's some major, say you end up in the hospital 3 times in a year, I'm not
Mhm.
going to wait till the end of the year to look at everything again. I think each time there's a big change in your medications or your health, that would be a good time to sit down and quickly talk about things again as well. And
Okay.
we're looking more so for redundancies or things we can stop, or just kind of make some tweaks based on these new medications or this new condition you now have. So can be more than once a year. It can be, some people need it all the time. They need multiple ones, which is fine. It doesn't, so just whatever works out between you and your pharmacy or your healthcare professional to do the review.
Okay. Excellent. Thank you so much.
No worries.
This was full of good information and we really appreciate it.
Great.
Yeah, hopefully we'll see you again maybe at the beginning of cold and flu season. We'll talk about immunizations again.
Sounds
What's
good.
coming up in the next year.
Great. Appreciate it.
Excellent. Thanks everybody for joining us and we will see you again next time.